Are you a medical student or junior doctor struggling to gear up your CV? Do you want to do a clinical audit but not sure how to get started? Don't worry, that's what the Academic Doc is here for. If you're new here, my name is Leher and I'm an academic junior doctor working in the UK. In this video, I'll be providing a step-by-step guide on how you can do a clinical audit with a real-life example. What is a clinical audit? An audit is a quality improvement process or a way to find out if our current clinical practice meets the required standard. This is different to a quality improvement project, which is another way to improve patient experience. However, there is no set standard and therefore they can be done a lot more rapidly. Research, in contrast, is a way to generate new knowledge about what interventions and treatments work and what is best. Clinical audits consist of a number of steps. I'll be going through each step one at a time. The first step is to identify the issue. It may be that you've already noticed something in your everyday clinical practice. However, if you haven't, don't worry. Some routinely done audits are on prescribing errors, record keeping, and complications from surgery. For the purpose of this video, I'll be using an example of an audit that I did on age-adjusted D-dimer levels. The second step is to set the standard. The standard may have already been set through local or national guidelines, or it may be something that you're aspiring to set. In my audit, I used national guidelines as NICE recommend that we use age-adjusted D-dimers in all individuals over the age of 50 to avoid unnecessary imaging. The third step is data collection. For this, you need to decide what your outcome is and then create a data collection form, ideally using something like Excel. On your Excel spreadsheet, you can put in the required details on all of the columns and then start collecting your data. It's important to define what your time frame is for the data collection process. It may be that you want to look back in time, or maybe you want to assess and collect data on patients as they're being admitted. For my audit, I collected data on all individuals over the age of 50 who were admitted to hospital with signs and symptoms of a DVT or a PE. I specifically collected data on their demographic details, their D-dimer levels, whether they had a scan and the details of the scan. The fourth step is to analyse your data and compare your performance with the existing standards. Are you doing well, or is there something that needs improving? For my audit, I calculated the age-adjusted D-dimer for all of the participants and compared this to how many would have been scanned if we had used the traditional 500 cutoff versus the age-adjusted D-dimer. The fifth step is to implement change. If your audit identified that you're meeting the required standards, that's well and good. However, if it identified that you do need to improve, it's worthwhile thinking about where the problem is and what you can do to improve it. Come up with some recommendations based on your analysis. It's important to inform everyone of the findings of your audit. This might be through developing a teaching session, putting posters up in the department, or updating the hospital website. The final step in the audit cycle is to re-audit. It's really important to go back and repeat your data collection process in a few months or maybe in a year's time to see if the standard has now improved. So why should you do an audit? Well, audits are really important as part of the clinical governance process as they help improve patient outcomes and patient care. They can also be done easily alongside your medical studies or job, and they're much more easier to do than original research. They also look great on foundation training applications and specialty training applications. So let me share some of my top tips for doing a successful audit. The first thing to do is to find a supportive supervisor. Most hospitals these days have a website that you can register your audit to, and this is a great way to get a certificate once you've finished the audit. And the last thing is to be smart. Be specific when it comes to choosing your topic. Try and narrow down the subject area rather than choosing a very broad topic. Make sure there's something you can audit against. Limit yourself to 1 or 2 outcomes and make sure you have all of the relevant software before you get started. Be realistic. Make sure that you are the right person to do this specific type of audit. And lastly, timely. Make sure that this is an audit that you can both enjoy and do a timely manner so that you have time to re-audit. So that was a quick overview of how you can do a clinical audit. If you found the video useful, please do leave a comment and subscribe to the channel. Thank you very much for watching. See you on the next video and happy auditing!